Hello everyone, and welcome to Coco MD TV, where we talk about mind and body matters because both your mind and your body matter. And today's topic of discussion is alcoholism or alcohol use disorder. What you need to know to help either yourself or a friend or family member get the help that you both need. So alcoholism is a chronic relapsing condition. It's a brain disease that's characterized by the need to drink, a loss of control over drinking, and then also like bad mood or bad things happen when you don't drink. So of course the psychiatrists have like this like very specific criteria, but we're not going to get into that. I think the definition I gave you was enough, but I do want you to know some sobering statistics. So 16 million Americans have been diagnosed with alcohol use disorder, and of those 16 million Americans, most are men, and then of course we have women, but 600 and 2,300,000 of those are adolescents. That's between the age of 12 and 17, yes, between the ages of 12 and 17, almost more than 500,000 kids are struggling with alcohol use disorder. So what I can do is give you some tips and tools to figure out if you are struggling with it. Because one of the things with alcohol use disorder, a big thing is denial. So it's really hard for the person who is struggling or suffering to get help because of denial. So what I want you to do is to either take a mental checklist or tally or write this down. I'm going to give you some symptoms, and then I want you to check off or just put a check and see how many of these describe you or your behavior. So number one, over the past year, have you ever drank more than you intended? So I started off saying I'm gonna have 2 beers, and then it ended up and I just finished the whole case. Number 2, tried to cut down but you could not. Number 3, have you spent a lot of time drinking or recovering from drinking, meaning like hungover and that kind of stuff? Number 4, have you ever experienced craving to drink? I really need something, I really gotta get it. Number 5, has drinking stopped you from doing important things at home, school, at work? Okay. Number 6, did you keep drinking even though you were having those problems at home, school, work? 7, have you stopped doing the things that you used to enjoy or the things that you used to do because of drinking? Number 8, have you gotten into risky situations because of drinking? This is unsafe sexual practices, drinking and driving, like legal problems and stuff because of it. Number 9, do you continue to drink even though you know that it can have brain and body problems, like after drinking, liver problems, diabetes? You still drink even though you know it can cause you harm or damage. Number 10, do you have to drink more than you used to get the effect that you want? And lastly, 11, do you experience withdrawal symptoms? That's like getting the shakes or something if you don't drink. Now, if you answered yes to 2 or more of those things, I need for you to talk with your healthcare provider about your drinking habits.
I know that this is kind of really abrupt, but I wanted you to see what a doctor means by just one drink. So that 12-ounce mug of beer or 5-ounce glass of wine or 1.5-ounce shot, that's one drink. That's what a doctor means by one drink.
So really quickly, let me tell you how alcohol can negatively affect your health. Number 1, you may not know this. I mean, of course, everybody always talks about your liver, but also your brain. It shrinks your brain. Okay, your mood, lots of depression, anxiety, sleep problems. You might take a fifth or like a nightcap or something thinking that it may help you fall asleep, but overall, your sleep overall is negatively affected, meaning it doesn't help you in the long run. Heartburn, liver disease, pancreas problems that lead to diabetes, weakened immune system, hormone problems, hearing loss, and thin bones and muscles. So these are the medical consequences of not tapering yourself when you drink. So if you, like I said, if you answered yes to 2 or more of those things, this is when you probably need to make a doctor's appointment. If you feel like this is a crisis situation that you need to talk to somebody today, I have provided information down below so that you can click the link and figure out the best way for you to communicate with somebody, whether that's through text, a crisis phone line, a crisis text line, a crisis chat. Like I said, one of the things that I deal with the most with people who are struggling with alcohol use disorder is that denial piece. Like, no, I really don't have a problem. So let me know if there's any questions or if you have any comments. Please like, subscribe, share this with someone who may need it. There is help. We do have treatment. That's what I wanted to say. There is help. We do have treatments for alcohol use disorder. Some of them are therapy-based and some of them are medical. Like, you know, sometimes if you're having overwhelming amount of anxiety because of the alcohol or not drinking, if you're having cravings, there's medication that can be helpful. Also, there's tons of therapy and therapeutic modalities that can help with the addiction aspect of it. So there is hope, there is help. I hope this has been helpful for someone. If you find yourself in a state of crisis, please seek help. Please click below if you need anything. Good luck. God bless.